Hello and welcome back to the Farm Doctor. Today we are going to discuss antidepressants, that specifically the selective serotonin receptor inhibitor. So let me tell you a quick background on how it works. You know how you have the presynaptic neuron and the postsynaptic neuron and then the synaptic space. So usually in the presynaptic neuron you have the serotonin inside being released to activate the postsynaptic neuron, which activates the neuron. So we have this block, the pink one that you're seeing, that takes the serotonin back inside the neuron. Why? Because let's imagine there's too much serotonin. We need a door, like your body automatically opens a door to take it back in to reduce the activation. So in terms of depression, anxiety, OCD, we want the patient to have a lot of serotonin flowing inside his body. So what we do is, because we know that when the serotonin reaches a certain level, the door is going to open for the serotonin to come back inside the neuron, we go and lock the door. We block it, we lock the door. So the door won't be open for the serotonin to come back inside the neuron, and it will keep releasing more serotonin and activating more neuron. That's why we call this drug the selective serotonin receptor inhibitors. They're like the blockers. And like we discussed, it's used for depression, anxiety, OCD, PTSD, that's a post-traumatic stress disorder, OCD for the obsessive compulsive disorder, panic disorder, and also social anxiety disorder. So a few side effects, as we can see from this patient right here, is insomnia, he couldn't sleep, and somnolence, like feeling fatigue and lethargic throughout the day. We could also have GI upset, which is keeping him up at night, sexual dysfunction, headaches, obviously seen from this patient, dry mouth, which you could see the tongue being cracked and the mouth as well being very dry, and increased sweating. And the serious risk is the serotonin syndrome. This is very important because if you combine it with a monoamino oxidase inhibitors or tritons, it causes the serotonin syndrome. You can see that this patient has bruxism, which is the grinding of teeth, and hyperflexia. You could literally tell that the patient is having hyperflexia, tachycardia, sweating, having like all these panic symptoms, coccygeal rigidity, like they can't even stretch their legs. So this is like a very, very serious side effects. But this is all seen when you combine with a monoamino oxidase inhibitor, so you have to really write this down. And we also see like increased risk of suicide rates in young teens and adults, so you have to make sure you monitor this drug closely. Plus, you don't even see the effect of these drugs until after 2 to 4 weeks. So like we said, the drug interaction is with monoamino oxidase inhibitor. So if the patient is taking a monoamino oxidase inhibitor, we have to make sure we avoid it for 14 days before we give SSRIs. So we do remember the examples of SSRIs like fluoxetine, paroxetine. So these are a few examples. We also have to make sure we avoid them with other antidepressants, not just the monoamino oxidase inhibitor. Avoid taking it with SNRIs, avoid taking it with tricyclic antidepressants, with tramadol, with fipzant. There are a few drugs that you have to make sure you avoid taking because SSRI inhibits the CP450 enzyme. If you remember, CP450 enzyme metabolizes a few drugs. So if you take SSRIs and it inhibits this enzyme with drugs that works with the metabolism of this enzyme, it could cause a high side effect. And if you take it with drugs that need this enzyme for activation, it could completely stop the drug from working. So you have to make sure you talk to your pharmacist and you understand the whole analysis of this drug. Lastly, I'm just going to show you a summary of SSRIs where we have sertraline, serious companions follow people, and that's like the key point. Sertraline, citalopram, fluoxetine, and paroxetine. And these are the few examples. You could see the key points here. Make sure to screenshot the slides and memorize it for your exams or just for your information as a pharmacist. This would really help, and good luck. Thank you.